So, good day and greetings from South Africa. It's really a pleasure to be here attending this important global gathering and presenting a case study about reducing the carbon footprint through the on-site treatment of healthcare risk waste in a rural hospital. So, the hospital in question is George Regional Hospital, which is located in the Garden district in the Western Cape. It serves a predominantly rural population of over 700,000 people living in a vast geographic area of 62,000 square kilometres. Transport distances are significant for our patients. So the Garden Route is an area of outstanding natural beauty, and you can see the hospital there nestled below the Outeniqua Mountains. It is also recognised as a biodiversity hotspot. However, in the context of climate change, water resources are already becoming more important. South Africa is sadly ranked as the most unequal country in the world. The contrast between rich and poor is especially evident in the Garden Route, which is a popular international tourist destination. However, in contrast, the people living here are confronted with massive health inequalities. The top three health equity concerns for our patients are limited access to healthcare services, largely because of the large distances between towns, farms, and healthcare facilities, a really high burden of disease, including infectious diseases, violence, trauma, NCDs, and maternal and child health, and poverty. Poverty in particular has had a growing impact on public health outcomes. We saw how hard the local tourism sector was hit during the COVID-19 pandemic, which has only added to unemployment. The direct and indirect effects of climate change have the potential to amplify the already existing health challenges and inequalities. We're witnessing this directly through increased frequency and strength of natural disasters. We've had years where we've had back-to-back devastating fires, and in the same time that Beaufort West, one of our towns, was in the grips of a 7-year drought. You can see the Gamka Dam there, sort of with next to no water in. George experienced significant floods. We also see the indirect effect where every year between November and May with warmer weather, the Western Cape experiences a massive increase in diarrhea cases, including hospital admissions. And if this is not detected early, it can be fatal for our small children. So we know the health consequences of climate change will disproportionately affect the most vulnerable and marginalised populations and increase intensity over time. For George Hospital, the treatment and disposal of healthcare risk waste was a problem to be solved. Previously, the hospital had to transport our infectious waste 430 kilometres away to a treatment plant in Cape Town 5 days a week. This was not only onerous, but also generated a significant carbon footprint. The sharps waste was also incinerated. By applying the proximity principles of waste management, the hospital aimed to reduce the carbon footprint associated with transportation, stop the incineration of sharps, reduce the cost of disposal and treatment of waste, and eliminate the risk of contamination during the transportation of our healthcare risk waste. The Newster plant at George was commissioned in August 2020. Equipment itself was funded by the provincial government. The Newster technology consists of a closed sterilisation vessel fitted with powerful rotating blades, which disintegrates and agitates the waste, heating it by impact and friction. When the waste inside reaches predetermined levels of 150 degrees C, the product is sterile. We track the volume and weight of the waste and the energy consumption on a daily basis. The transition from off-site to on-site treatment of infection waste has significantly reduced the hospital's carbon footprint. Waste is turned into a non-recognizable and harmless material with no visible sharps. There's a significant reduction in the volume disposed to landfill. There's substantial savings every month in terms of operational costs, and most notably is the 99% reduction in transport emissions and big impact on our carbon footprint. The project also supports the local economy by employing 2 waste operators. So what are the next steps? The technology has already been implemented at 6 other hospitals in the Western Cape, albeit much closer to Cape Town. We're looking to reduce the volume of infectious waste that we generate and treat on site through improved segregation, through ongoing training of staff. And we're looking to install a solar PV plant in later this year to really supplement the hospital's energy usage. So it remains a strategic priority to position George Hospital as a health system leader in the Western Cape in responding to climate change and providing more sustainable healthcare services. Through action, leading by example, and advocacy, we're looking to implement measures and really to improve the organization's environmental footprint. Um, I'm standing here presenting this, but really sit on the back of an amazing team at the hospital who do all of the hard work and have really made this project possible. And and thank you to the rest of the audience for listening. It's been a pleasure to be part of this conference and presenting our case study. Thank you.